order the meeting tonight for the Board of Health here at the Harwich Town Hall, Don B. Griffin Room. As required by law, the town may audio or video record this meeting. Any person intending to either audio or video record this open session is required to inform the chair. Anyone? No? All right. Chance for any public comment to open. Yes, sir?
Yes, Joe Fournier, JFF Design Architects. I'm requesting to have our case for... Hi, yes, Joe Fournier. We're actually presenting for 9 Cottage Ave. If you wouldn't mind, if we could adjust our agenda and be heard earlier.
Gary's already informed me when I walked in, we're going to make you the first order of new business. We'll bump you right up.
Set the
We got
stage for
something else
tonight.
first, but absolutely.
All right, thank you so much.
You're welcome. Anything else from the public? All right, minutes of the previous meeting for Tuesday, June 18th. Question, without Pamela here, can we vote on this if she wasn't here to accept it, or do we have to wait till next month?
We have to wait till next month on these.
We're gonna put the minutes off until next month.
So
Do we have to
July,
vote for any of
July
it?
you can vote on, but I think Pam was absent for June, so.
Okay, so
Yeah.
June's we will postpone to next month. July 16th minutes.
Move to accept.
Anybody have, move to accept? Do we have a second?
Second?
Vote?
Aye.
Aye. July 16th minutes have been approved. June will hold off. Next order of business, we do have a work session with intern
So we have
Sonda.
our.
Ijibusonma?
EJ Busanma
It was close.
Ugandu
Okay.
is going to be presenting the opioid abatement research that she conducted for us this summer.
Thank you, Sonma. Floor is yours.
Thank you, everyone, for having me. Please let me know if you can hear me. Can you hear me all right?
I can hear you.
Awesome. Let me share my screen. Can you please see my screen?
We can.
Awesome. Hello, everyone. My name is Ije Busanma Bundu. I did my research this summer with Harwich, focusing on empowering communities through promoting access to judgment-free harm reduction programs for opioid use disorder on the Cape and the Islands. A little bit about me: I have a master's in public health, social and behavioral sciences. I have vast knowledge in infectious disease. I did cholera research in Nigeria, and I'm currently a fellow at Friendly Health for HIV. But I also have knowledge in mental health and substance use disorders program evaluation. This summer, I basically assessed the opioid epidemic across the 15 towns on the Cape. I looked at the strands and...
Oh, you're cutting out a little bit, Sona.
Can you hear me?
Yep.
Where did you lose me?
When you started talking about the research you did in the 15 towns.
So I basically assessed the opioid epidemic across the 15 towns on the Cape. I looked at the strands of these programs. I proposed recommendations for growth.
I think we lost you again. Yeah, I don't know if you want to try to turn off your video.
Employment and onwards. This summer, I will talk a little bit about... Do you want me to turn off my video?
You keep cutting in and out.
Is it hard to hear me? Okay, let me turn off my video. Is this better?
Yes.
Okay, perfect. I apologize. I think the audio is better. So I basically will talk to you a little bit about the Massachusetts opioid epidemic I will share with you a little bit about how these funds are used. I sat on an office hour in July to look at these three towns, Lowell, North Andover, and Worcester, to basically analyze what they've done with their funding. I will share a little bit about these different towns and programs they've done on the Cape. I will identify core strengths. I will share a little bit about my research methods and findings, look a little bit on the areas for improvement. There were few priority needs on the Cape, so I'll share a little bit about the correlation between mental health and substance use, using social determinants of health. I will talk briefly about health equity, and I will share a lot of ways to support the population with mental health and substance use programs. A little bit before we talk about what goes on the Cape, we need to understand where these funding is going to. So 60% of the funds in Massachusetts goes to the state and 40% goes to the municipal towns. Why is this important? It's important because since COVID, over 3,000 opioid-related deaths have occurred. There has been an increased trend over the years, which shows that there needs to be a lot done with prevention, support, and education. And all of these things can really drastically reduce the opioid addiction and epidemic through community-based interventions. Looking at this graph to your right, you would see it was gotten from the Care MA Abatement Funding Partnership website. It is easily accessible to the public, and you can identify and see what these different Massachusetts towns are doing with the funding allocated to them. Looking at Cape, from 2020, since the pandemic, there has been an increase in the opioid-related deaths. But one thing that I really understood and got from this experience, from 2023 to 2024, there has been a slight decline in the deaths. This is due to the preventive programs, the supportive programs, and the educational programs that towns on the Cape have done to support the residents on the Cape, which is really good. To think about what these fundings are basically allocated for, you need to think of the prevention programs, the treatment programs, the support programs, but you have to understand how are all of these programs supporting the people at need. If you assume, or if a program is not supporting the most amount of people versus another program, it's better to allocate resources to the one supporting the most amount of affected people from the opioid. It's very important to facilitate regular discussions among stakeholders to assess your beliefs around the opioid and to also reduce stigma. But it's also important to look and utilize mixed methods, surveys, focus groups, to really understand where the people are at and see what effective ways to support them. You can also collaborate with local agencies. It's also important to ensure that these programs are sustainable in the long run. And how are we also engaging the students, the kids, through educational programs to also reduce stigma around opioid use? In July, I sat on the Care Abatement Office Hour and I listened to these three towns share what has been done in their different towns. And I used it as a baseline to basically analyze what the Cape has done and see what exactly needs to be worked on or improved on. So in Lowell, they have done a lot of discussions around how to use the funding. Unfortunately, the harm reduction programs in Lowell have been solved. And a lot of community members feel like they need a lot more transparency of how the funding are allocated so that they can feel like there's support for them. There are some towns in North Andover, they haven't done planning and implementation yet, but they are starting to have discussions and conversation around what needs to be done to support their town. One thing that stood out to me was in Worcester, where they've done a lot with health equity, they've done a lot with supporting and understanding the health gaps within the community. And they've collaborated greatly amongst partners to ensure that there's access to crisis treatment and what the people need in that moment. But the one thing that they've decided to say they needed more work on is to ensure that there's access to treatment for substance use disorder like Narcan for people of color or the most impacted in their demographics. But the silver lining from this is after analyzing and using these towns as baseline, at the Cape, there are a lot of preventive and implementation that has been done to support the residents to empower them to get the help they need, which is really good. My research this summer, I basically spoke to 15 of the health agents for 30 minutes. I used a lot of literature review to back up my findings. And I also sat and used the 3 Massachusetts towns I spoke earlier as a baseline to see what has worked with them and what is also better, what Cape Cod, a lot of the towns here have done that has been very crucial in ensuring population health is key. Population health has been impacted greatly. For my statistic analysis, I use logistic regression using SPSS. So these were the common themes that I got from this analysis. It's important to have biannual meetings because it fosters a lot of conversations, it improves program evaluation, program coordination. And when you talk amongst yourself and understand what's working and what needs to be improved on, there's a lot more work in getting more outreach and having more people know what's going on in the regions. There's another thing that really stood out from a lot of conversation, which is the stigma impact. When you're able to assess the beliefs that you have around opioid use and substance use, you can start finding ways to find solutions to help the people, the population around the stigma. It could be education. It could be creating safe spaces and brave spaces for the people. And lastly, one important thing is the health disparities. How are we ensuring that there's equitable resources for everyone impacted in that time? From speaking to all the amazing health agents, I correlated the various programs that have been very helpful and beneficial to the people. What stood out for me, a couple of them were the recovery coaches, which have been immersed resources to the population. They have been at the hotspots to talk to residents, to share resources for help. There have been a lot of recovery centers, which is amazing. One that stood out to me a lot was the fishing partnership, which supports fishermen with Narcan training. There's a lot that goes with the recovery coaches and yoga coaches. It's really good to see transparency where some towns have not done a good amount, but there have been a lot of planning and implementation in progress, which is really great. And something important as well as transportation services. It's very important to have access to where to go to get your help. There's also the mobile unit, which supports with harm reduction services. And another thing that really stood out to me was the mental health programs for the police department and the EMS. It's such a great thing that has been done, especially listening to the chief talk about how impactful it has been so far for him and his crew. And also the educational program aspect of kids learning from presentations about the dangers of drinking and driving. Those are the great things that has happened so far on the Cape that has been very impressive and has tied into prevention, support, and education. One recommendation is just doing more awareness about more program initiatives like Moms Do Care, which supports pregnant women resources, and LGBTQ Center of Cape Cod as well. From the previous slide, I shared a little bit highlighting a good amount of the strengths, like the access to 5-day housing, recovery centers. It's really good that the 15 health agents I spoke to agreed to be more collaborative. It really shows a lot of strength that people agree to something that they need to work on. It's really great to see that out of Cape, they've done a lot of collaboration to pull in their funds and resources to expand on the opioid use. Orleans have funded a mental health support system for first responders. There's also been a lot of Narcan boxes around hotspots. And the great thing about it is that they're trying to do a lot more trainings in to community members, which is very important. There's a lot that's been done to provide early prevention educational support to schools, which is very important. And there's a lot that has been done through providing mobile vans that provides harm reduction services to people and their families with opioid use, which is very good. Some areas or recommendations for improvement. It's very important from my analysis with me and my other colleague, we realized that there needs to be more focus on the restaurant workers. How can we support them in outcome, mental health, substance use trainings? How can we support the managers as well? How can we increase peer support specialists in the hospitals because of the overflow? We need to increase more of that. We need to improve visibility. So in your local health department websites, it's very important to have like a section for substance use so that people can easily reach there whenever they need guidance or whatever they need someone support. If you have a recovery coach, you can put the recovery coach's information there if that's possible. Another thing that's very important is to be accountable on the programs you anticipate to create, or have set deadlines. If you plan on creating a program for kids at a certain point, make sure you're actively setting deadlines for yourself so that you're able to implement it in a timely manner. Other things is fostering with discussions and collaborations amongst yourself, ensuring that you are evaluating the program's efficacy. If something is not working, it's important to allocate funds to programs that better serves the people. Other things that are really important is promote health equity initiatives, which I'll talk a little bit later, and reduce health disparities using social determinants of health. And other towns that have not implemented any programs yet, it's really better to adapt to other successful programs that other towns have done. Other things that I've said in previous slides, it's very important to assess your beliefs and expectations regarding the treatment and what it is about opioid. You also want to conduct cultural competency trainings for all stakeholders so that they're able to better serve the people in need. Mental health and substance use were one of the core priority needs from the needs assessment. There is a bi-directional relationship between both. In Massachusetts, 50% of people with substance use experienced mental health issues. And on the Cape, 35% of people dealt with similar issues as well. Looking at the social determinants of health, you need to understand what are some ways that we can support the people living in our environment, living in our communities. How is the impact of these certain issues? What's the impact of opioids on people of color, LGBTQ, restaurant workers, veterans? Why is there an increase in all of that? So thinking of like trauma, socioeconomic inequalities, racism, high stress job, insecurities, PTSD, all of these things, if they're not taken in contact on how to interact with the people around us, we would not be able to target our audience or improve population health. So how can we support these demographics living in our communities? We can implement culturally sensitive programs addressing poverty, access to care. It could be through workshops. You can also use community support networks. You can also train managers to recognize mental health and substance use signs, and also advocate for better wages. We can also ensure that there's comprehensive access to VA services and create educational programs around substance use and mental health risk. Thinking of health equity, we need to think of how can we ensure those equitable resources across all demographics? How can we ensure that people are met where they are? We can think of community engagement. So far, local health departments have conducted community needs assessment to address the regional priority. Some recommendations which has already been implemented on the community needs assessment that I've seen from CARI is needs to ensure that there's focus on the communities affected by overdose crisis, like homeless people, LGBTQ, people of color, veterans, restaurant workers. Another thing to think about is oversight and accountability. Accountability is crucial for tracking the funds, measuring the progress, and ensuring transparency. For example, the Outer Cape local health departments have already set a metric to measure the efficacy of programs. Other towns can definitely adapt to this process and this approach. And the most important one out of all of them is using cultural humility. You need to focus on how the messaging and how you respond to the community needs. How are we ensuring that the people have all the resources they need? How can we ensure that people feel like they are listened to, their concerns are heard? If someone has issues around their family member using opioids, how are we ensuring that the way our tone is very sympathetic? How are we ensuring that we are responding in an appropriate manner? So different ways that this can really help in strengthening all our efforts. Provide culturally competent trainings for all stakeholders to review policies and programs for underserved population. We need to engage local organizations and impacted individuals for feedback. And the last slide is tying everything together. These are the main support initiatives that could really strengthen all the efforts together. Promote services that offer mental health recovery resources, which, from what I've heard, has already been set in motion through LISA. We need to also train and support peer navigators who have gone through the similar experience so that they can provide mentorship and support to others. We need to also facilitate a lot more community hearing gathering for people to share experiences in a safe space and brave space, and also discuss ways for mental health wellness and substance use recovery in a safe, non-judgmental environment. A couple more would be to encourage collaboration between primary care providers, public health nurses, to screen for mental health and substance use issues regularly and offer equitable resource of integrated care, as well as incorporating all of these mental health substance use prevention education into school curriculum to promote early awareness and intervention. We also need to engage community members in research. So community members ensure that if you feel like you need support, or if you feel like the town or the community needs more help in something, do reach out to local health departments and share your needs. Or if a local health department shares survey or something that needs data, please do record and please do answer all of that so that everyone can collectively raise solutions which are culturally and contextually relevant. And this is the references. Thank you. Okay.
Thank you so much, Sonma. Your work this summer was so beneficial to us. We were very lucky to have you this summer.
Thank you so much. Thank you.
Thank you.
Right. While Sonma was giving her presentation, I did see a few people come in a little late, and I think many of you signed in, but if you have not at this point, please sign in at the desk over in the corner by the door. We will be moving on at this point to old and unfinished business. On April 26, 2024, Health Department received a complaint from the occupant of 10 Old County Road, Unit 2, regarding concerns of rodents being present in the walls of their unit. We had on July 24th, one of our Health Department staff, Meredith Ballinger, and Health Inspector Jennifer Singleton, they conducted a follow-up inspection regarding the complaint. Majority of the repairs had already been made. Replacement of the front screen door, secured points of entry for pests around the perimeter of the building, replacement toilets in both bathrooms, repaired floor in the front hallway, and contracted Eco Geek for pest remediation. Outstanding repairs include repairing the oven and stove, fan in the kitchen, and repairing the screen windows in the kitchen as well. Occupants shared that they have not experienced any more signs of pests and stated that they will be moving out of the unit in a month. Landlord representation shared they plan to make more repairs after the occupant has moved out. Health agent requested a follow-up inspection once outstanding violations are addressed and prior to the move-in of a new tenant. So we do have a couple of options. Option one, we can have continuance if we require additional information. And option two would be to not uphold the existing order issued by the health department and not require any further action.
I think that option 2 got on there by error. So I think your option would be either continue it until all violations are corrected or to remove it from the agenda pending a follow-up inspection in satisfaction of the health agent.
I mean, everything needs to be corrected
Yeah.
one way or the other as far as I'm concerned.
I think that was from the last meeting,
Okay,
which I think they were appealing, so.
fair enough. So, it sounds like things are at least in the works. So once the resident moves out, the rest of the repairs will be made before any future rentals move in. So does anybody have a motion?
So we would use the move to continue the hearing?
So you can continue it or you can remove it from the agenda.
I move to continue the hearing for 10 Old County Road on the next meeting, September 17th, 2024.
Second.
Vote?
Aye.
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 From the agenda for the new business.
So, new business, we are going to have a slight change in the order. We are going to address first the variance request for 9 Cottage Ave, reconsideration of previously approved variance conditions, increase in habitable space.
Thank you. Good evening. I'm Joe Fournier with JFF Design Architects on behalf of the owners, Bill and Tiffany Crooker. Bill is actually with us online this evening, and thank you also for adjusting your agenda for our consideration. This evening, we're actually before you to request a variance, excuse me, as a change from the 2018 variance with respect to additional living space for this parcel. Bill and Tiffany just recently purchased this property earlier this year. They're not new to the neighborhood, they're new to the home. They actually sold their home on Hiawatha. They were in need of some additional living space, so they thought that this would be a perfect candidate. We're not proposing additional flow, so we thought that this was a fairly easy suggestion, and one hopefully that will be improving to the neighborhood. We're renovating the second floor, increasing the bedroom sizes, making them en suite, and making the space a little bit more conducive to today's living style.
Any comments from the public that's here? Any questions or comments from the board? No. I agree with no increase in bedrooms and really no increase, minimal increase in habitable living space, really just an adjustment of the already existing rooms and no increase to the flow. I certainly would agree to approve it. Do we have a motion from the board?
Motion to approve?
On the back. Along with the previous conditions.
Okay. Move to approve the reconsideration of previously variance conditions for 9 Cottage Avenue with the following conditions. The dwelling is restricted to a maximum of 3 bedrooms. No further increase in space or square footage without further review by the Board of Health. No garbage disposal is allowed. The conditions and approval shall be recorded at the Barnstable Registry of Deeds.
Do we have a second?
Second?
Vote?
Aye.
Aye.
Thank you very much. As a matter of record, I have our,
Thank you.
Thank you.
do you want the return cards too?
Yes, those-
I only have one to date, I can get you the rest.
that's okay. Thank you so much.
Thanks so much.
Moving on now to B, variance request 141 Bank Street, reconsideration of previously approved variance conditions, increase in habitable space.
Good evening,
How are you?
Dave Crispin with the BSC Group. Can you hear me tonight?
Yes, we can.
Sounds good. I would love to, I know the applicants are in the audience there, Molly and Garrett.
I'm here.
I would love to share about a 6-person slide with you. Can I do that? Let me. This one, let's see here. I'll do that one. I'm not sure what we're sharing now. This is interesting. I love this stuff. Looks like you get myself on the screen. How do I do that?
You need to share a screen down at the bottom of the screen. You see the share in the middle there, find the camera and the tools.
I should be able, here we go. This should be you somewhere in here. This one. There we are. Very quick. I have about 7 slides I'd like to show you. Are we seeing 141 Bank Street?
We are.
Yes.
Okay, sounds good. Well, first of all, this is at the corner, basically, of Hoyt and Bank Street. It's right beside that big cranberry bog that was just regraded and cleaned up in the back behind the property. And we were before you a year or so ago when we were trying to plan this thing out. Since then, we have put a plan together. We've been through the Conservation Commission, and there is an order of conditions now recorded at the Registry of Deeds. The story on the house, the existing house, is it is a 3-bedroom house, which is in your packet, little circles around the 3 bedrooms. A cottage that currently has 2 bedrooms, and your agent was out there a while ago, and it was kind of agreed that if they remove this doorway and widen this so that it met your definition, this room did not become a bedroom. So existing 1, 2, 3, 4 bedrooms. We're going to widen that doorway out to about 61 inches, and that will no longer be classified as a bedroom. That is so we can build a 2-car garage and move Garrett's office from off of his kitchen table upstairs to the 2nd floor of the garage. That we calling that as a bedroom, we end up with a 5-bedroom system. This is a copy of the record plan for the septic system. The cranberry bog is off to the left. Bank Street is off to the right. The red square is the recharge, the soil absorption system. This is a 1,500-gallon septic tank, pump chamber, pumps up, it's a pressure dose system. I did do a limited inspection on this a year ago, and everything looked like it was doing well. So with that being said, this is the plan for the Board of Health, is to connect the septic tank to the 2nd floor of the garage, redo the bedroom into a non-bedroom in the dining room, and we end up with a 5-bedroom house. So that's kind of where we are. That's kind of a close-up. You can see a little, it's a very short piece of pipe, really, as far as that's concerned. And the variances in 1999 will remain unchanged because we're not touching the soil absorption system or any of the tanks. And those variances were 5 feet to a property line, 20 feet from a foundation, which is down to 11 feet, and 100 foot from the top of a coastal bank, where 59 was provided. And because they've modified that bog, I am honestly not sure if that cranberry bog is a coastal bank anymore or not, but It doesn't affect the variance, so I don't think we're going to even ask that question. And that's where we're at. So I'll be open to questions very quickly.
When I was taking a look at this one, I mean, everything seemed appropriate. I saw the change of the open doorway to 61 inches, keeping the total number of bedrooms at 5. So overall looking with no other changes in the variance, unless I'm missing something entirely. Carrie, if you have any other recommendations, it does seem pretty straightforward to me.
The only thing that we would ask is a post-construction walkthrough, just to confirm the 5-foot opening.
Yeah.
But that would be a condition of the building permit once we got there.
That's fine, yeah. We have one for the conservation too, so.
Anybody in the public have anything to add regarding this issue? Any questions from the board?
Nope.
No? We can have options to continue or approve. Does anybody on the board have a move?
Move to approve. The considerations of a previously approved variance conditions for 141 Bank Street with the following conditions. The property is restricted to the maximum of 5 bedrooms, 3 bedrooms in the main dwelling, 1 bedroom in the cottage, and 1 bedroom office above the garage. No further increase in habitable space or square footage without further review by the Board of Health. No garbage disposal is allowed. The conditions and approval shall be recorded at the Barnstable Registry of Deeds.
And a post-construction inspection.
And a post-construction inspection.
Is there a second?
Second.
Vote?
Aye.
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 Thank you, guys.
Yep.
Appreciate it.
You.
Thank you very much.
Thanks, David.
Take care.
Next order of business, definitive 8 lot subdivision, 1594 and 1598 Orleans Road. Request from Town of Harwich Board of Health Regulation 1.211.
Good evening. Can you hear me okay?
Yes.
Oh, great. Susan Ledoux from Eastward Company, presenting the proposed subdivision to you this evening. As was read in the legal ad for this, 2 existing vacant wooded lots at 1594 and 1598 Orleans Road, totaling 8.45 acres, and they're located in the RR and WR zones. We're proposing to subdivide the property into 8 building lots. Each lot will be at least 40,000 square feet with 150 feet of frontage on a 900-foot cul-de-sac road subdivision serving all the lots. The Board of Health reviewed and approved this preliminary subdivision last July 18th on 2023 with the condition that the definitive subdivision plan be submitted for full review under the requirements of Board of Health Reg 1.211 and the submission of the environmental impact review. And the Planning Board had approved the preliminary plan on August 8th of last year. We've submitted the required definitive subdivision plan set, which I believe you have in front of you, the application package, and we address the requirements of Regulation 1.211 and the groundwater impact report, which has been prepared by Strong Tree Engineering. And that includes a nitrogen loading calculation, and without going through each number, it will end up being 8.3 parts per million, which is less than the US EPA standard for drinking water. Each lot, again, will meet all the requirements of the zoning bylaw. A total of 32 bedrooms are proposed, so that's 4 bedrooms per acre per lot. And our engineers have said that there are no nearby private wells, wetlands, or waterways. I believe the closest bog is about a half mile away, and waterways are between a half mile and a mile away. Stormwater generated within the road is captured, treated, and disposed of with stormwater surface treatment areas and recharge basins along the south side of the road in the cul-de-sac. And then all proposed homes will be connected to municipal sewer when that becomes available and installed, and we start building homes. We will be attaching to the municipal sewer, so no wastewater will be going into the ground. So we feel that the proposed project will have little to no negative impact on the surrounding area. I'll be glad to try to answer any questions. Thank you.
Any questions or comments from the public?
You want to just
Sir.
get up to the podium,
Step on
please?
up.
Yep, introduce yourself. Thank you.
I'm new to this, as you can tell. Good evening. Thank you for your presentation. My name is Dan McLennan, and I own a home on Huckleberry Path, one of the abutting properties. I believe the lot number 5 will be the one right behind me. So it may not be the place to ask this particular question. Obviously, it's the groundwater impact report. I haven't read a lot of the information. Of course, I'm sure that things are probably done appropriately there. I do have a little bit of a concern or a question relative to how the lots are going to be sited or graded that may impact runoff, rainwater, however the lot is sited, what kind of vegetation might be left present at the back of the new lots. I do have some trees and shrubs there, but I don't expect that a lot of them will be as a barrier. So when I saw that this, receiving the letter to come and listen to this presentation, I wanted to get that information, but if you had a comment relative to how the lots are sited relative to the adjacent properties, that would help me understand it a little better. Thank you.
Sure. Can I address that?
Oh, please.
Absolutely.
Yeah, sure. The planning board will actually be reviewing this on September 10th, in a couple of weeks. So that's when we get more into the grading and all of that of the lots. But these lots are very large lots. They're 1 acre buildable lots, and just any concern about stormwater and grading, per the requirements of the town and the state, we have to contain all stormwater runoff on the lot, cannot leave our lot. So I don't think there should be a worry about that on adjacent lots. And with such large lots, we typically do leave a vegetated buffer. I can't tell you where a house is going to be built now, and it depends on the topo, but I believe this is pretty flat. There's not, well, there's a little bit. I'm looking at the topo plan now. So it will depend on the topo, but we always create vegetated buffers if trees are taken down. And we have setback requirements also. So, the house will not go into the required setbacks. We will meet those, and again, we'll control our stormwater runoff.
Thank you, Sue. And like you said, you're going in front of the planning board on September 10th to address those concerns. Okay.
Yeah.
Any questions or comments from the board? Nope. I remember this one coming through, and that the groundwater runoff, that was the biggest concern of mine. I read that part of the report very thoroughly. I'm happy to see where it's come in. So I would move to approve this. Is there any movement from the board?
I move to approve the definite subdivision plan for 1594 and 1598 Orleans Road with the following conditions. The subdivision be restricted to 32 bedrooms total. No further increase in habitable space or square footage without further review from the Board of Health. No garbage disposal is allowed. The conditions and approvals shall be recorded at the Barnstable Registry of Deeds. design, operation, and maintenance agreement for alternative systems shall be submitted to the health department.
That's another typo, because they're going to be, it should be that they shall be connected to sewer,
Okay,
because they're sewer, so there's no IA treatment here.
sorry.
No, that was my error on that one.
Second?
Vote?
Aye.
Aye.
Okay. Thank you very much.
Thank you,
Have a
Sue.
good night.
You too.
Moving on to D, variance request 11 Pilgrim Road. Reconsideration of previously approved variance conditions, increase in habitable space.
Yes.
I'm Jeannie McKenzie, the owner of 11 Pilgrim Road. And we're proposing to move an already existing bathroom to a covered porch area to create like a flow of the staircase so that there's more flow on the main floor. And we're also adding a bathroom off a bedroom upstairs, as well as a bathroom in the basement.
Any,
Properly.
close enough. It's pretty simple one here, but is there anybody else in the public that has any comments or questions? Any comments or questions from the board? Any discussion? Option to continue or to accept. Is there a movement from the board?
Option 2, move to approve the reconsideration of previously variance conditions for 11 Pilgrim Road with the following conditions. All previously approved variance conditions remain in effect.
Do we have a second?
Second.
Vote?
Aye.
Aye.
So it's approved.
It's approved.
Okay, thank you so much. Have a great night.
Thanks, you too.
Thank you.
So your next packet is for the next two filings. They're doing a nitrogen easement for 24 Nathan Walker Woods, but they're putting the easement on two separate parcels, so we're hearing them differently, but the packet materials are the same for both.
All right, approval of nitrogen aggregation plan for 19 Cherokee Road and 24 Nathan Walker Road.
Good evening. Attorney William Kroll from Kroll and Donovan Law LLC. Now, I have a new partner, Attorney Mike Donovan, as of 4 months ago. And we're here tonight to represent Rick Cleary, Richard Cleary, and Hope Hour Cleary, who are seated behind us. And Attorney Donovan is going to make the presentation this evening.
So we submitted, we worked with Ms. Schoner, and we submitted two applications, but as kind of she just explained, for the nitrogen aggregation plan, there's one lot, 24 Nathan Walker, that is going to be giving the land or creating the easements on that land for two different lots, 19 Cherokee and 30 Cherokee. So we used, along with Ms. Schoner, we used the DEP guidelines for the nitrogen aggregation plans, and we put together both Exhibit 1 that you'll see, that's actually the plan itself that shows the properties, which you have it along the top is the 24 Nathan Walker, which is the long kind of lot there, and then it's identified on there two easements, A and B. And so addressing kind of easement B first, that easement that's kind of in the middle of that lot is going to go and relate to lot 19, which is the 19 Cherokee. And that should back up, I guess. The purpose here of this is, I think, probably self-explanatory, but by creating the burdens on that lot so that they can't use that land for any kind of sewer, we're then being able to get the benefit of that land on these other 2 lots. And so, right now, the easement B is going to the 19 Cherokee, and that's 11,910 square feet, that easement, the size of easement B. And that, in our package, is going to be on Exhibit 2 is the easement. It's one easement because that land is both properties are owned by Richard and Hope Cleary. So it both have a credit and facility land, so there's a burden on that land, and then the benefit of that land on that same lot. So it just requires that one Exhibit 2, which is completely based off of Attachment 3 of the DEP guidelines. And so that document is the easement that would get recorded and then would travel with the land, throughout time. And by doing that, then that now creates over 30,000 square feet for the 19 Cherokee, which would permit a 3-bedroom septic system on that lot. So that's as to the 19 Cherokee. Same plan, Exhibit 1 in our papers, now moving to easement A, which is 13,000, like I said, it's not as good as it used to be, I think 800 there. That goes to 30 Cherokee. And that was set up with Exhibits 3 and 4 as the actual technical easements themselves. Exhibit 3 is what is to the benefit of 30 Cherokee, saying they're going to receive the benefits of that easement. And then Exhibit 4 is on the 24 Nathan Walker, saying that that easement A area there is going to be encumbered by this easement. And then that likewise, when you add that 13,800 to the 16,000 there, you get a little over 30,000 again. Right now, that lot, 30 Cherokee, has a house on it. There is a recorded variance on that for 1 bedroom, because at the time it only had 16,000 square feet. If this were to be approved, it would now have over 30,000 square feet, so we'd be looking for a change to that variance to restrict it to a 3-bedroom septic system. And the documents, are somewhat technical, but they're all based off of the guidelines that are set through by the DEP. So we followed those along with Ms. Schoner, and I've sat down with her and gone through those. We think everything's in order to put forth what the DEP has already set up as a structure for doing these type of aggregations. So at that point, I think I would just ask you if you have any questions, let me know, or if I didn't explain it clearly.
This is one of those ones I kind of tried to read through and understand most of it. I agree. Do you have any comments for us, Carrie? Your insight on this one would be
Everything that they're
welcome.
asking for is well within the allowance of Title V.
Okay. Anyone else here from the public that has any comments or questions?
Good evening, members of the commission. I gather this is protocol over here.
Yes.
My name is Charles Katuska. My wife and I live and own property at 31 Cherokee Road, which is a direct abutter to 24 Nathan Walker Road, the credit parcel in this case. Before I move on to the couple of questions that I do have, I'd just like to point out that the documents submitted indicate that there is currently a house under construction on 24 Nathan Walker Road. It's my understanding that that house is completed. There hasn't been any construction activity at the house for months. And in fact, the building department has issued a certificate of occupancy for that property in April. So whatever difference it may make to the board that the property is completed, there's a septic system on 24 Nathan Walker Road now. So that's just a fact. The other point that I would make is that in every instance in the DEP documentation and in Title V, the required plan in this case is specifically referred to as a facility aggregation plan in order to differentiate it from a community aggregation plan, which would be something obviously that the community would put together. I note that the Demarest plan is not so titled, and if it's the regular protocol of the board in circumstances like this to require that the submitted plan be titled appropriately, then I would ask that you consider that. Other than that, I suppose my first question is, does the board see applications of this nature on a regular basis?
So to answer your first question regarding the entitlement, it would just be what we would look for as a nitrogen aggregate facility plan. So.
That's what you have received?
Nitrogen aggregate, yeah,
That's
plan.
then what you have received. And again, if it's the routine procedure of the board to accept a plan so titled, thank you.
And it's not something that we see monthly, but I would say maybe one a year is not uncommon. Maybe more before when there was more land available, we might have seen more of them, but
Okay.
generally you need an acre of land in this area to develop a 4-bedroom house. So what this does is it gives property that is unoccupied by that amount of bedrooms that this lot could accommodate, and it grants those bedrooms to an off-site property. There are conditions that it has to be in the same zone of contribution, which these properties are in the same zone.
In the same zone too, the public
So
water supply wells.
The recorded easement with the Registry of Deeds would prohibit 24 Nathan Walker from developing that lot to its max capacity. And what was the acreage of Nathan Walker?
3.
3 acres, so he would be entitled to 12 bedrooms if he wanted a 12-bedroom.
Well, there's a
property.
2-bedroom house that's currently been constructed on the property, so I would presume that a 2-bedroom septic system was approved for the property already.
2 or 3,
But
most likely
the the underlying purpose of this application and this procedure under Title V is, and please correct me if I'm wrong, is to allow lots of a certain size to develop a septic system that would normally be prohibited on lots of this size.
Correct.
So by restricting acreage on another site, thank you. Okay, so I'm clear on that.
If I may add to that?
Yes, please.
I've probably done 5, 6, or 7 of these in the last 20, 25 years. I had one gentleman who owned a property in South Harwich that was very long and not good for anything else, and he sold off or restricted 4 or 5 portions of that lot and was able to achieve some income from that, but probably done it 6 or 7 times.
I appreciate that. Even an experienced attorney is telling us he's done one every 3 or 4 years.
Most people don't want to have an easement on their parcel. Generally, people will try to find a smaller vacant parcel that they can purchase and own outright. So this is,
Yeah, given both of these
Yeah.
properties are under the same ownership, it makes perfect sense, and I couldn't agree with you more that they're absolutely entitled to this relief under Title V. I suppose I'm trying to educate myself on your time. Thank you for that opportunity.
absolutely, that's what we're here for.
So the only other question I have is, it's not the case that additional septic systems are going to be constructed on these easement properties. Is that true?
The easement properties will remain untouched. The impacts will be to 19 Cherokee and 30 Cherokee.
Okay, thank you. Given that the proposed easement B is directly along our
Yep. The
our
septic
eastern
does
property.
need to maintain on the property that's being developed.
Thank you. And thank you for your time.
Yeah, absolutely.
Any other questions or comments from the board?
So just a reminder that these
Two
are
separate
two
issues.
separate, so you'll vote on one, open the next, and then.
Is there any motion from the board on the request for approval for 19 Cherokee Road and 24 Nathan Walker Road?
I move to approve the nitrogen aggregation plan dated August 7th, 2024, prepared by Demarest Land Surveying for 24 Nathan Walker Road and 19 Cherokee Road. These two are together.
These two properties are together, and then 24 and 30 are together.
Okay. A fully executed grant of Title V nitrogen loading restriction and easement be recorded at the Barnstable County Register of Deeds with a copy returned to the Health Department. 19 Cherokee Road be restricted to 3 bedrooms. There shall be no increase in square footage or habitable space without further Board of Health review. The credit land shall adhere to the prohibitions and provisions set forth in the easement documents provided with the application. The Harwich Board of Health will not consider any variances from the Title V or Harwich Board of Health regulations for construction of the dwelling.
Do I have a second?
Second.
Vote?
Aye.
Aye.
Aye. 19 Cherokee and 24 Nathan has been approved. Do we have a motion from the board on 30 Cherokee Road and 24 at Nathan Walker Road?
And this one will read a little differently because we are rescinding a one-bedroom deed restriction and applying a 3.
I move to approve the nitrogen aggregation plan dated August 7, 2024, prepared by the Demarest Land Surveying for 24 Nathan Walker Road and 30 Cherokee Road. I recommend the following conditions: a fully executed grant of Title V nitrogen loading restriction and easement be recorded at the Barnstable County Registry of Deeds with a copy returned to the Health Department. Rescind the existing one-bedroom deed restriction for 30 Cherokee Road and create a new restriction limiting to 3 bedrooms. There shall be no increase in square footage or habitable space without further Board of Health review. The credit land shall adhere to the prohibitions and provisions set forth to the easement documents provided with the application. The Board of Health will not consider any variances from Title V or Harwich Board of Health regulations for the construction of the dwelling.
We have a second.
Second.
Vote?
Aye.
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 Thank you. One logistics, the easement documents themselves need to be signed by the local approving authority. Is that, do we have to come back for another hearing, or once we execute the documents, we can just submit them to you and
Yep.
get them signed?
Yep.
Okay.
Great.
Thank you.
Thank you.
Appreciate
Thank
it.
you.
Thank you.
Thank you.
We all need to stretch ourselves a little bit, a challenge here and there.
We have the agenda for it tonight, so.
Yeah, right.
All right.
Thank you.
Have a good night.
Have a good night.
Report from the Health Director.
Mosquitoes.
Yeah.
We are seeing a increase in West Nile virus and triple E virus in mosquito samples. Testing was conducted by Cape Cod Mosquito Control, has detected increasing levels of arbovirus in the Commonwealth due to the movement of birds carrying viruses such as West Nile virus and Eastern equine encephalitis. It is predicted that Cape Cod will be seeing even more mosquito samples testing positive in the coming weeks. As of August 9th, 4 samples of mosquitoes collected in Barnstable County have tested positive for West Nile. Since late July, there haven't been any additional samples that have tested positive for triple E. Cape Cod Mosquito Control continues to urge residents and visitors of the Cape Cod region to heed the following. Please avoid mosquito bites and use EPA-registered repellents. Potential disease vectors for West Nile virus are active at dusk and after dark. So precautions should be taken to avoid mosquitoes at these times. The species that transmit this disease prefer to lay their eggs in man-made containers like tires, tarps, gutters, and children's toys that hold water after a rain event. People can reduce the mosquito population in their area by checking their property for standing water and dumping it out.
I haven't seen too many mosquitoes around.
Good. We did
Clearly
have,
don't live anywhere near me.
yeah, we did have another report today with a mosquito-positive case in Dennis, so they're,
I heard there was 2 in Dennis.
2 in Dennis? Really?
Well, that was unconfirmed rumor as far as what I heard. Yeah.
I'm not aware of the amount. I thought it was 1, but I didn't check the numbers, but.
Unconfirmed.
Yeah.
But if there's There's at least 4 here that we know of on the Cape.
Really?
Yes, everybody should be aware.
Yeah, we have one, I think, one human positive case in Massachusetts, but mosquitoes are testing positive.
My daughter
so.
spiked a fever of 105 after camping last weekend. I was starting to panic, but
Yeah.
she all of a sudden cleared up and she was fine.
Glad to hear that.
Thankfully. All right. Next order of business is correspondence, and we don't have any. So we'll move past that to the permits. New permits are listed in the agenda.
What is this? Confetti? I'm not sure what kind of business this is.
This is an event. I am not sure what they are doing. Jen Singleton, our food inspector,
Yeah.
reviews a lot of these applications. I would imagine that it's pastries, but
I wonder. Jacob Bruce Donut. Is that a place?
that is a food truck as well. A lot of these are
Trucks.
food trucks for events that have come up. Most of the renewals have been issued at this point, and we don't have any new businesses going in.
Do we have any motion from the board?
Motion to approve. Motion to approve.
Okay?
Second?
Seconding, do we have a vote?
Aye.
Aye.
Aye. I don't think we have anything else. Do we have a motion to adjourn?
Motion to adjourn.
Second?
Vote?
Quick second.
Very good.
Vote?
Aye.
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 Very good.
Great.